Patients will often call and ask me, can we please do this under local anesthesia? I'm just mortified from general anesthesia, and I'd rather be awake for these procedures. And I tell them, you would not rather be awake. So can you explain a little bit about that?
It's important to appreciate that you can either have a board certified anesthesiologist to do your anesthesia, or a CRNA, which is a certified nurse anesthesiologist. CRNAs are great in hospitals because there's a lot of oversight and there is always multiple anesthesiologists available. In a surgery center, I use a board certified anesthesiologist. I'm more comfortable knowing that my patient is being looked after by another physician, and I can concentrate on my work, because when you have a nurse, then you're responsible for them and yourself. I want to be responsible for the surgery so I can focus on the surgery. As you know, I do complex surgeries and it takes a lot of mental
a lot of focus
efforts to do the surgery. So with that said, if you talk to a board certified anesthesiologist, they will tell you that the safest modality of anesthesia is general. Why? Because when you're having general anesthesia, they have IV access, which is super important, and they have access to your throat, and they can control your respiration, they can control your blood pressure, they can control your heart rate, so they are in full control. Whereas with local, there is no access. So if anything goes wrong, you may need to be intubated. Local becomes dangerous when it takes too long to do and too many areas. So when you look at the cause of death after liposuction that was more prevalent a few years ago, especially in other states, where there are different countries where there are different restrictions and different monitoring, it always was the local, giving the patient too much local anesthesia. Why is local anesthesia dangerous? Because usually the surgeon is using lidocaine, and lidocaine is the numbing agent that creates the numbing before surgery. But if you give a patient too much lidocaine, they can go into arrhythmia, they can go into respiratory depression, they can die, and that's what happens. People think, well, I'm having local, it's safe. It's not safe unless it's very limited and very controlled, and you're having it with the right surgeon. So typically, it's not the modality of anesthesia that is dangerous. It's the amount of medication that is given that makes it dangerous. And that's why with local anesthesia, when the surgeon is administrating the anesthesia and at the same time operating, and the patient is uncomfortable and then getting more local, things can become even more tasking than having a general anesthesia.
That's another thing I tell patients, is that if you're under local, your physician is worried about you feeling, oh, I felt that. Oh, I felt that. Oh, so it limits them. They can't be as aggressive as they want to be. And therefore your result won't be as good as it could have potentially been had you been under general anesthesia.
Absolutely. I mean, imagine what we do. For example, when I do a Brazilian butt lift, or sometimes for other patients that want to get back liposuction, I'm liposuctioning the whole back, starting from usually the buffalo hump at the top, essentially back of your neck, coming upper back, mid back, outer chest, lower back, sacrum, love handles. Usually it's 4 or 5 liters of liposuction taking 2 or 3 hours. You can't do that under local. That's so painful. People who haven't had liposuction don't appreciate how painful liposuction can be. Essentially, you're having a rod, a metal rod going forth and back continuously. So if you want to have it under local, you can probably do a very small, limited area. But when you get into big liposuctions that is more prevalent in our practice, I can't do my job. I can't do my job under local, because a 3-hour surgery will take 6 or 7 hours to perform. and then giving that much local is dangerous. You can have lidocaine toxicity. And also you have to constantly be injecting the patient and they're uncomfortable and you can't do your job. I need to be able to go from top to the bottom to the sides and get all the areas and crisscross them so that I end up with an even result and pinch them and make sure everything looks symmetrical. And with local, you don't have that ability because some areas will not be numb and the patient will feel it and then say, So you don't go back to those areas because it's painful and then they end up with an uneven results. That's the reason we don't do liposuction under local. Sorry.
Yeah.
Yeah.
I think it's important for patients to understand that.
Yeah. Well, because they won't get the result.